Months, 19,494 deaths later, New York City in the midst of the second wave of the coronavirus. Things could get worse before they get better because of the holidays.
Yeah, this is a warning posted by our guest on her social media page. It reads, take a listen, a Zoom Thanksgiving is better than an ICU Christmas. And she is speaking from experience.
Isn't that the truth? We're joined this morning by emergency room Doctor Arabia Mollette, who remains on the front lines of the pandemic. Good to see you again, Dr. Mollette. Thanks for coming back.
Hi, Danny. Long time no see.
Seriously, I'm so glad you're back here this morning and safe. 9 months in, I want to ask you how you're holding up, and have you taken any time off since we last spoke in March?
Oh, I definitely have. I'm much better than I was before. It was, as you know, at the beginning of the pandemic, many of us were struggling. And even after the numbers had decreased in New York, many of us were struggling with post-traumatic stress disorder related to COVID-19. And so I did take some time off to reflect and to get myself together, my mental health and my physical health. Especially, I invested in a Peloton bike, so that definitely helped out a lot.
There you go.
Yeah, that's a stress reliever. And you're going to need it because we've been talking about the second wave. Some say we are already in it. How are you getting prepared for that?
Well, you know, in New York, many of the hospitals have already started stocking up on personal protective gear, ventilators, and pumps, as it was mandated by Governor Cuomo. So by October 1st, many of the hospitals already have enough supply to last for at least 90 days as needed. And that's really important because at the beginning of the pandemic, many of us were struggling without these resources, and it became even more of a harrowing experience because co-workers have fallen ill to COVID-19. And so many of the hospitals throughout New York, as mandated by Governor Cuomo, has already stocked up on supplies.
So you have enough ventilators, because that was a big issue.
That was a very big issue. That was a very big issue. And remember, at the beginning, Governor Cuomo had made sure to enforce that the majority of all the hospitals in New York, including New York City, will receive more ventilators and beds and other supplies.
And I want to focus back on you for a second, because I know, you know, the attention is always on the patient, but you and your colleagues have gone through a lot. Are you mentally prepared? I know you took time off. Are you mentally prepared to handle the next wave? Because we talk about COVID fatigue, and that could impact you also mentally. And last time you were here, you were pretty emotional just about when you walked out the door at the end of your shift, you would break down and cry. How are you preparing this go around?
I think this time around, because of taking the time off and also receiving counseling throughout this pandemic, has actually helped a lot. Of course, it actually helped me to mentally prepare for this surge that we're about to receive, or actually we're in right now. And so I think it also took a lot of the community effort. A lot of people from the community that we serve, are also just poured a lot of support, not only towards me, but towards the nurses and other allied healthcare professionals that are on the front lines in this pandemic. And I also want to say that, you know, Governor Cuomo and other local politicians have made sure to also help us throughout this pandemic. So it just took a effort from New York. You know, I'm a New Yorker.
I know you are.
We survive. We are tough. We cry, but, you know, we don't stay down, and we have to keep pushing through. But, you know, who's to say what's going to happen in the future? Right now, it's just best to focus on the present and hopefully prepare the best way possible, for this current pandemic.
But taking account the holidays and what you're going to see in the hospital could be very difficult for you.
Of course.
Of course. Thank you.
But I think right now that we're more prepared. Right now we're detecting COVID-19 earlier. We learned so much from the beginning on how to treat patients. With availability of drugs like remdesivir, is more in favor of patients that are in the early stages of the disease and without severe symptoms. And then also medications like steroids for those who are in oxygen therapy and with severe symptoms. And so we came a long way basically from March and how to take care of these patients, which means a lot.
That is fantastic to hear from you on the front lines, that you have a better handle on how to treat it when people come in immediately. You are an eternal optimist. You know I love you. And I thank you each and every day for what you do on the front lines. Please stay safe to you, and thank everyone that you come in contact with at that hospital. Thank them for us too. We do appreciate everything you do.
We need each and every one of you. Thank you.
Take care. Thank you.
And I think what you said is so important because they know how to treat it in a different way this
That's-
time. And because we're looking at the mortality rates, right? And they are seeming to drop. So people are not dying as
Right.
in droves like they were the first time around.
I love